is Marjorie Skubic, and Marjorie, you did a talk this morning on what was it, squaring the life curve with supportive technology. Can you tell me a bit more about your talk this morning?
The purpose of my talk was to show how we can have in-home sensors that are mounted in the environment, completely non-wearable, no batteries to charge, nothing to remember to do, and they're targeting seniors to be able to recognize very, very early signs of health problems so that they can get interventions done early when health problems are still small before they become catastrophic.
Okay, that sounds really interesting. So what kind of sensors are you talking about here?
Well, we have a bed sensor that we've developed that goes underneath the mattress. It captures quantitative pulse rate and respiration rate and restlessness in bed. It captures what they call the ballisticardiogram, which is the mechanical effect of the blood flowing through the body as a result of your heartbeat. So it can capture this completely non-contact, very unobtrusive sensor that goes underneath the mattress. And also gives you sleep patterns so you can see how that might change over time. Then we have a in-home gait analysis system that uses a depth sensor that gives us effectively three-dimensional silhouettes of people as they move about the scene, about the home.
Okay.
And that is also designed to be very non-invasive. It does not require anybody to wear anything, put anything on, charge batteries. It just works and it watches how they move around the space and captures walking speed, stride time, stride length. And all of these can be used then to determine whether somebody is at risk of falling. Now we do actually capture falls using the same depth sensor device. It's looking at the shape of the person. But we'd like to be able to identify when somebody is at risk of falling, because then we can hopefully prevent the fall in the first place. That's a real win if we can do that.
Okay. So when you say you'd like to try and identify someone falling, are you talking about using that information to find out if their heart rate's going very slow or very fast, or is it something else you're looking at? How would you be able to interpret that someone is at risk?
Well, there's a number of fall risk assessments that have been validated over the years. And we've done enough studies now that we can actually map our average in-home gait speed that is detected using these unobtrusive depth sensor devices. We can map that to a standardized assessment that has been shown to give you different levels of fall risk depending on the score that one would get. So that's one way we can tell whether or not somebody is at risk. We did a recent study. There was a paper that was just published in 2016 that shows that if your in-home walking speed changes by a certain amount over a week, that is a very strong indicator that you are likely to fall over the next 3 weeks.
Oh wow, that's interesting.
And so we want to be able to identify those cases so that we can give somebody help in balance and gait so we can prevent the fall in the first place.
And apart from falls, is there any other things that you're looking at with that data, in terms of risk?
So in general, we are looking for learning a particular pattern of activity for an individual. And we look for when those patterns begin to change. And that is oftentimes an indication that there has been some kind of a health problem that's been introduced. And these sensors are actually so sensitive that they detect these very subtle changes before the people themselves even realize that anything's going on. So it's a variety of different things that happen. For example, if you have a person who has a more frequent bathroom use suddenly, especially if they're getting up in the middle of the night and using the bathroom a lot more often than they would otherwise, that may be an indication of a urinary tract infection.
Very much so.
Sometimes people don't realize that because it comes on sort of gradually and they're not just, they're just not paying attention to that. If somebody's sleep patterns change, it might be because they're experiencing some kind of pain, if they're more restless in some way. there could be some kind of a problem that occurs. We've seen instances where people may have congestive heart failure. They go to bed at night, but they can't sleep the rest of the night flat in their bed, so they'll get up maybe after an hour or two to sleep in the recliner chair for the rest of the night. And that can be an indication that their congestive heart failure is worsening. There, of course, is the fall risk issue. There can be other, other kinds of similar sorts of problems that can be identified.
And so with that data, so say you did recognise someone was becoming worse, like congestive heart failure was worsening and they needed to see a doctor, does the doctor watch this information, or does the patient themselves get contacted, or where do you go to from there when you've got that information?
Well, so far the way we've been using this is that we send out these health alerts to the clinical staff, and typically they would be nurses or social workers, a combination, that can look at the alerts and interpret them and figure out whether an intervention is warranted. We're investigating how this might be used in private homes. Right now we do this in nursing, housing, senior housing sites. So there's a clinical staff there, and the system acts as a clinical decision support system. We've done a few pilot cases in the home, in private homes, in which case we look at the private home as sort of an extension of the clinicians that may be from some kind of a housing site. So particular, where I live in Columbia, Missouri, we have a housing development that's called Tiger Place, named after the University of Missouri mascot. And it's been developed, built by AmeriCare, which is a private company, but the nursing component is all run by the University of Missouri Nursing School. And the private home test cases that we're doing are then administered from the same nursing staff out of Tiger Place as kind of an extension of what they're doing with the Tiger Place residents. So something similar could be done for people in private homes, maybe using a home health agency to be able to administer those.
Yeah, that sounds good. Sort of making a two-way communication somehow.
Yes, right.
The phone or text message or something like that with the patient.
Or actually video conferencing.
That's a good idea. They can tune in.
We've been investigating the use of FaceTime, for instance, to use for video conferencing for that purpose.
I see. So that'd be a good follow-up, wouldn't it? Then from the data and then using the FaceTime to tune in and see what was happening at the home.
Yes.
Good. Okay. And you dedicated your talk to your parents, is that right?
I did, yes.
Is there any sort of connection with that, with the story and your parents, that you could like to share?
Well, my mother is 92, my father's 95.
Congratulations.
They live in their own home in Brookings, South Dakota. They want to stay living in their own home. They don't want to leave. So they've been kind of an inspiration on this work all along. Many of these monitoring systems that people are developing seem like they're almost looking for an excuse to kick mom out of her home. And our perspective has been completely different. We're trying to identify very early signs of health problems so that we can get mom help, so that we can help keep mom in her home, independent and functionally active. And that's very much where we're going. That's very much the focus of what we're doing.
Sounds really good. Sounds like a good goal. Okay, well, thank you, Marjorie, for coming in and talking to us. I hope you enjoy the rest of the conference. We're just on day one at the moment, aren't we? So there's plenty more to see.
Yes.
Yes, cool. Okay, thanks very much.
Thank you.
Thank you.